Hi, my name is Cvintal. I'm an ophthalmologist from Brazil. I'm a cataract, glaucoma, and dry eye specialist. I've been using Keratograph 5M for the past 5 years. And what's the importance? Dry eye today has a very high incidence. We know that in the general population, 30% of the people have dry eye. Above 75 years old, over 45% of the population have dry eye. And for instance, in the population with glaucoma who uses prostaglandin, we know that almost all patients have dry eye. And why? Because the drug is toxic for the glands. And how can this help me? Dry eye is a very interesting disease. Why? Sometimes symptoms and signs are not very well connected. And patients can refer some kind of strange symptoms, but it's not clear to them that that's caused by dry eye. And these kinds of exams can make it very, very graphic. So I can take it and show to the patients. So I'm going to show you some examples. Meibography, or the picture of the meibomian glands, it's a very unique characteristic for this machine. We know that when the patient has less than 50% of the meibomian glands, they are going to have symptoms, or we are going to see signs. And here is very graphic. The machine is going to take a picture, and I can show the patient, say, hey, you have a problem, we have to treat it. For instance, we know that in the normal population, the glands are straight, just like a piano. And when they get older, or when they get the disease, you have like a limitation of these glands, and they get atrophic. Another example of these exams is here. Let's see. So here we can see all the exams. So here they give you a summary of all we can do with the machine. Another very important picture here is the Nick boot. When we put fluorescein in the patient and try to see the breakup time, sometimes can be subjective. And when you use Keratograph 5M, it's going to transform the subjective into a picture. And this we can show the patient and say, see, you have dry eye. And after the treatment, you can show the difference and say, see, you have improved. Another very interesting exam is the redness. So you can take the picture and quantify the redness of the eye. This is not only good for dry eye, but for other inflammatory diseases. All this you can put in a graph and score it to the patient, make him believe he has dry eye, and if he has get better from after the treatment. And this is very important with the new treatments like IPL and like gland expression that we have today.